Hey, we're back. Difficult subject. I know, cancer support. I didn't know what else to use. I didn't know what else name to use. Thought about it last night. On my way back from South Carolina, my brother-in-law passed, and difficult week, and what am I going to talk? How am I going to present this subject? How am I going to present this topic? This is a difficult topic. So, reading early on my way home last night, early this morning, putting some things together. I should just do this. The list just kind of goes on from a supplemental standpoint. But my key thoughts here today, how do we help someone battling cancer? How do we help them with support? How do we get them through these difficult times? So is there a magical nutrient that you use? Oh, I heard and I read about this. I read about artemisinin. Well, there's a lot of good things about artemisinin. It's kind of very difficult to get in this country. The FDA frowns upon it because it's, utilized in the world of alternative cancer treatments, and the FDA doesn't like that when you make claims. Artemisinin has some very interesting components to it. But as a general theme, where do we want to start? How do we help someone through cancer support? That's the theme today. It's not about just taking a bunch of different supplements. Now, I listed things. Gamma-E tocopherols, melatonin. What about certain types of protein? Why? What about glutamine? What about probiotics? So I think I'm just going to run through this and then talk to you about the areas, the pitfalls that we fall into. Part one, this is part two, obviously. Part one centered on dispelling some of the myths. Today, I don't want to dispel any more myths. I want to tell you that there's enough literature out there that supports the fact that if you're a cancer patient, you're a cancer survivor, you've got a family history of cancer, maybe there are some folks in your family that are battling cancer, how do we improve their status? How do we change their ability to handle and to deal with this? Before we do anything, I just want to read to you out of Psalms, just as a word of encouragement. Create in me a pure heart, O God, and a new and a steadfast spirit within me. Renew a steadfast spirit within me. Do not cast me from your presence or take your Holy Spirit from me. This is right after David's unfortunate escapade with Bathsheba and the death of Uriah, and a very difficult time with David. And David finally begins to come back and is penning Psalms after an 18-month hiatus because David was lost. He was away from God. And he repents and he turns away from his sin and he comes back to God. And I just love this. This is one of my prayers. Create in me a pure heart, O God, and renew a steadfast spirit. In other words, God, not only I would ask that you would cleanse me, I'm coming to you in repentance, a returning, a changing of heart and of mind and of attitude. But also, Lord, don't take your Holy Spirit from me. Don't take your presence from me, and restore to me the joy of your salvation, and grant me a willing spirit. So literally, God's saying here in the Bible that you can pray to God to give you the desire. I often pray for my children, for myself, for my family, to have a greater hunger for Him and for the things of God. Renew in me a steadfast spirit. Thanks for being with us today. A lot of material to cover, so let's just get right to it. Cancer support. What are the big things that we're dealing with here? When folks are battling cancer, there are issues with what is known as cachexia. They break down. Breaking down, what do you mean by that? The cancer treatments many times are so overwhelming. The chemotherapy, the chemicals, the radiation, they're so damaging. They take such a toll on us that it's very, very difficult for folks, in many cases, to continue their therapies. Another area, and I have it here, it's called cancer cachexia, that literally that one of the concerns that we should have in the world of oncology, and I'm not an oncologist, this is to kind of bring some areas to light for you, but the one area is that we should understand that the role of cachexia, breaking down of the body, is key. So why we will discuss whey protein smoothies, how it sustains the immune system and what happens. But this is interesting. I want to read you this. This comes from a 2012 article, Medscape article, says the overall risk for acute myeloid leukemia and myelodysplastic syndromes is not increased in the first 3 years after breast cancer chemotherapy, researchers say. However, of the 41% of the chemotherapy patients who received anthracycline types of chemotherapy, it's a specific form, there was almost a 4-fold increase years down the line of myeloid leukemias, myelodysplastic syndromes, in other words, damage to the bone marrow. So, Joe, all this technical stuff, what are you after? I think what I'm after here, it says adriamycin is known to cause blood diseases, such as leukemias, within the first 2 years after administration. We need to follow women longer. We should know the results should not, in the more liberal use of, in other words, we use this to try to kill one portion of bad things that's going on in the body, and then we open up a controversial component or damage in a distant site. My whole point in bringing that up is the article that I discussed last week about the role of all these potential adverse effects and all these negative things, the discussion in the world of chemotherapy by oncologists. Don't use support. Don't use natural preps. You can't do it. They interfere with what we're doing. We need to be more concerned about the folks that are dying of heart attacks after specific types of chemotherapy, those that have damaged, they're ototoxic, ear functioning, damaged kidneys, peripheral persistent neuropathies, pain in the extremities. We need to be worried more about the toxicities as opposed to worrying about how folks are trying to help themselves naturally. But remember, qualified individuals, you should have support. You should never do this on your own. Don't do it based on information that you just read by some blog site, something on the internet. You can get information, but be careful about sitting down on that and making your decisions based on that. Key area, we can't have folks breaking down through their treatments. That's what we want to prevent in our discussions today. Number two, there's so much worry, concern on behalf of medical practitioners about how natural things are going to interfere, when the reality of it is there's a huge amount of negative impacts that folks are suffering and dying from, of the negative impacts. Let's worry a little bit more about that and let some of the integrative components to this scenario be in the hands of folks that are pretty comfortable with what they're talking about and have some education and some background. Cancer support, where do we go from here? What do we do? The first thing, I think, is to really maintain and help folks so that they don't become cachexic. And cachexic means you just begin to break down. So what you will see, often what we will do is we will put folks on a regimen that has key proteins. For example, things like a very high quality whey protein isolate, a New Zealand whey, or a plant-based protein, high levels of glutamine. We'll use glutamine in addition. Why? Because through chemo in particular, there is a huge breakdown of the body. There's damage to the immune system. There's damage to your white blood cells. There's damage to your red blood cells. There's damage in many cases from the chemotherapy to your bone marrow. The immune system becomes severely impaired. Folks begin to become cachexic. They break down. Literally, you begin to lose lean muscle mass. The body starts to self-consume because in many cases I'm not eating enough. So what we'll do is we'll put folks on high protein smoothies with live foods, fresh or frozen berries, no sugar or low sugar almond milk, rice milk, maybe a half of a banana, smoothies. Ice, drink these smoothies. Why? Raw nutrients, raw material. You begin to become very debilitated and depleted in your protein. If your protein stores are diminished, you can't repair, you cannot adequately detoxify, you cannot restore the immune system. So we will use some very significant, powerful, but specific forms of proteins as just a basic mechanism to keep you from breaking down. Number two, we might use high levels, maybe about 2,000 milligrams or 2 grams a day of glutamine. Now, I know that you say, wait a minute, I thought you were just going to give me an ABC that everybody should do. No, we can't do that because it depends specifically on what you might be battling, the disease state, the cancer, the types of chemotherapy that you might be using or radiation therapy. Then that would tailor. Remember, this is a generic overview. This is so that you get a better feel that there's something that you actually can do to help yourself. So we're going to use glutamine. Why will we use glutamine? And I don't want to keep writing all over the board and erasing the whole time, but glossitis, stomatitis, folks become very damaged on chemo and many times radiation. Their oral mucosa has ulcers, there's mouth ulcers, there's sores in your mouth, in your throat. You can't drink, you can't eat. The gut wall, the intestinal wall is highly damaged. So we need to use a specific amino acid, glutamine. Now this is controversial because some people say glutamine stimulates cancer and you're actually hurting them. Really not much literature to support that. There really isn't. Actually, glutamine is shown to improve in some cases, in some literature pieces, folks' sensitivity to chemotherapy. The real key why we're doing it here on an empty stomach, away from chemotherapy, is to restore the body. So number one, high whey protein or plant-based protein smoothies. Number two, depending on the type of chemotherapy, some we won't, but depending upon the type, we recommend specific sources of glutamine. Help the immune system, help prevent mucositis, glossitis, ulcerations in the mouth, ulcerations in the gut, damage to the gut wall. Why? So that you can continue to eat and restore and maintain your own nutritive status. Number three, why would we think about probiotics? Well, you just talk about probiotics for everything. No, chemotherapy destroys the microflora. It completely why folks in many cases can't withstand the rigors of chemotherapy, because they're not being adequately supported. We've got to have them on probiotics to restore the gut wall, along with some whey protein smoothies, along with some glutamine. Now this is ABC, so I thought you were going to give me something for specific cancers. I tuned in today because I have breast cancer and I want to hear that is in specific one-on-ones, although I will give many examples. But we've got to do a basic overview so that you have a grip and an understanding. Number four, the use of melatonin. Now, why is melatonin? And it's not controversial. There are numerous studies done in Italy by some integrative oncologists. Paolo Lusoni, a researcher and oncologist in Italy, has been using melatonin for years in cancer, chemotherapy, radiation therapy. Started with studies in animals and showed that in animals that they gave high doses of chemotherapy agents to, as opposed to having significant damage to their immune system and their blood parameters as to how you monitor that, there was a great reduction in the amount of damage done to their immune system, their white blood cells, their immune cells, when they were on melatonin. So you said, wait a minute, aren't you supposed to make melatonin? Absolutely. You're supposed to. Great diminishment when we're under the gun with chemotherapy. I believe that if you just look at these four, the key whey or plant-based protein smoothies, they've got to be clean sources, bioavailable, utilizable. They have to have a very high amino acid content. They have to have a high, now this is important, so this is why this gets, I needed 6 boards here today, Josiah. You can actually look on the labels, and if the globulins and the components, the specific components of the immune globulins are not listed on your protein prep, then it's not worth its weight. It's empty. It's a mass-produced, not highly refined, not highly purified, not bioavailable source of whey or plant-based protein, because the microfractions should be listed, and they'll list for you the lactoglobulins, the immune fractions, the immune stimulating fractions that come from key proteins is really, really important. Number two, we're going to go over and make sure that we're doing some glutamine, because glutamine in specific chemotherapy can help to maintain, to protect the oral mucosa, the gastrointestinal mucosa, the esophagus, so that I don't have impairment to drinking, to eating, etc. Number three, we've got to use probiotics because of the destruction that takes place. And number four, melatonin has to be on board to protect against the immune system. Now let's talk about that. We know that high doses of melatonin, via some literature from Lasoni and other researchers around the world, that under high doses, high intense regimens of chemotherapy and radiation, there are huge immune suppressive types of activities that take place. The immune system is knocked out completely. Folks become very compromised, very weakened, susceptible to fungal yeast infections, overgrowth. They begin to break down. They become cachexic. So if I don't have them on some key sources of protein, good bacteria, glutamine to repair the esophageal, the oral mucosa, the alimentary canal, and I don't utilize some melatonin, this is big even with breast cancer, what happens is, in many cases, the therapy or the regimen that they're on becomes greatly compromised because they're not able to withstand the rigors mentioned before, because they become neutropenic, leukopenic, drops in your immune parameters. Then patients are at a high risk for death from the chemotherapy because their immune system is so debilitated and they can catch anything that from anybody that they're exposed to. So they say, wait a minute, you're making a claim that melatonin is some type of chemotherapy agent? No. These are all supportive agents. They are support to help the body through these difficult times so that the body can restore and heal. Next, you've got to lower inflammation. So I would say, not that it's number 5, but it's got to be 5. Why? Because what we know is metastases, one of the metastatic issues, how cancer spreads, is through the triggering of inflammatory proteins. We call them cytokines. Interleukin 6, interleukin 10, tumor necrosis factor alpha. They become highly elevated. They're inflammatory. They stimulate, they encourage metastases, spreading of the cancer to distant sites. If I can tone down the signaling, and if I can reduce TNF alpha, if I can reduce interleukin 6 and interleukin 10 and so on, I reduce the inflammatory pathways. I reduce the potential for spread. So metastases. So I'm doing something to protect the immune system so that I don't become as broken down. I'm trying to drive raw nutrients in with very high fractions, the microfractions of protein constituents. It must be why our pure protein essentials. It's New Zealand whey. There are no hormones. It has a high lactoalbumin and all the other fractions of the globulin fractions, very high. It is a microfiltered ion exchange, extremely clean. You've got to have some whey proteins. Glutamine, you've got to do the probiotics because the stripping of the microflora opens you up, compromises you. Then you got to reduce the amount of bad signaling that comes. Now, from here it becomes, I would say, it becomes not grayer, but now it gets a little more specific, and there are probably 25, 30 different directions you can go in. I can talk about proteolytic enzymes, which I may, if time allows. I'm going to talk a little bit about I3C, which especially in breast cancer is important, in prostate cancer. I can talk a little bit about L-carnitine, that how folks even show, it's an amino acid, that how we show that when they're undergoing chemotherapy, that their musculature, the energy is so broken down, so debilitated, by the use of L-carnitine, you can restore skeletal muscle function. I can talk about L-car, acetyl L-carnitine, which is the literally almost is the direct bloodline of this. But the acetyl portion of the L-carnitine, see, it's acetyl L-carnitine versus L-carnitine. So that's where we get Al-car from. What happens is for neuropathies that are associated with many platinum-based compounds, cisplatin, carboplatin, specific chemotherapy agents are ototoxic, severely toxic to the ear, to your hearing mechanism, severely toxic to the kidneys, and horribly damaging to the neuropathy, the neurologic pathways causing neuropathy. Acetyl L-carnitine, high doses of pyridoxal 5-phosphate, P5P, which is B6, can reduce that. So wait a minute, am I going to use all of this? Remember, I'm covering the broad picture. This is big picture. This is big picture. We have to be able to then isolate this down. Not everybody's going to be on gamma E tocopherols, a specific form of vitamin E. Some might. Not everybody is going to be on I3C or lignans, which I'll explain in a moment. Not everybody is going to be on vitamin A. It depends on what we're doing and what you're dealing with. A broad overview. Next, very important to me are the levels of vitamin D. Because vitamin D, especially in breast and prostate cancer, the lower the vitamin D, the higher the incidence to begin with. So D is not some chemotherapy agent, but we know that D has immune balancing, immune stimulating, immune modulating preps to it, or concepts or properties. Vitamin A, in radiation, many times I will recommend the use of vitamin A along with pycnogenol and some other things. Why? Not when they are actually taking the radiation, but after their treatments and maybe later in the day after they've gone in for a radiation treatment. Why? Because vitamin A is very supportive to tissue repair. You have radiation, you have ionizing radiation beams going through the body that are damaging tissue, everything in sight. It's creating oxidative damage, so you don't want to use a ton of antioxidants with radiation before they go in for their radiation, their ionizing radiation treatment. But post it, later in the day, you can do some key nutrients like buffered C, like vitamin A, like pycnogenols. Why? Because it helps to reduce some of the collateral damage. Collateral damage. Radiation, you want it to be able to hit the bad tissue, but now much more specific therapies today than it used to be, but you still have collateral damage. So we're after trying to protect some of the collateral damage. Acetyl L-carnitine, L-carnitine, specific areas, maybe specific forms of treatment and cancer treatment and chemotherapy. They both have their benefits, some to the skeletal muscle, L-carnitine to the cardiac muscle. If you're on what's called an anthracycline, you could be on adriamycin and that family. They're technically antibiotic/chemotherapy agents. Those anthracyclines are hugely toxic to the heart. CoQ, L-carnitine. I mean, someone undergoing an anthracycline adriamycin regimen for breast cancer or other types of cancer needs to be on a form of CoQ. This is controversial because there are some practitioners that completely poo-poo this. But without me, I pulled out a bunch of folders today. I have stuff, once again, everywhere. I can't go through these things one by one. We would be here all day. You'd be asleep. And I can't do that. But what I can do, and I'm going to say, take my word for it, but if you're battling some area and then when we sit up and do a one-on-one with you, then it's easier for us to just make copies of this information. And again, look at what I have here, and this is a portion of it because it's such a broad-based topic. Some chemotherapy damages the nerves, some damage the kidneys, some damage your hearing mechanism, some damage the heart. So, for example, if you're on a platinum compound, I might not be recommending, for example, that we would do CoQ and L-carnitine. I might have you on some gamma E's. I might have you on some buffered C. I would actually have you on some P5P, a form of B6, because I can use higher doses, pyridoxal 5-phosphate. I would have you on that E, as mentioned. I'm going to do some different things to try to protect the nerve tissue, the neurologic tissue, maybe some CoQ, so that you end up with horrible neuropathy, horrible kidney damage from this. You might be on an anthracycline like adriamycin. Now my gears switch. Now I'm going to go to, I'm going to do some of the basics, the 1, 2, 3, 4, 5 scenario, all right? The smoothies, quality proteins, possibly some glutamine, melatonin, time released at bedtime, lots of probiotics. Why? Because the microfloral stripping the immune damaging components. We want this to protect the immune system. I'm going to probably use some omegas, reduce those inflammatory proteins. Why? Because they stimulate metastases. But now then you start sifting down, you're going to get more specific. Specific chemo agents have a cardiotoxic effect. Well, I'm going to do and recommend very high doses of coenzyme Q10, and I'm going to recommend some pretty high doses of L-carnitine, among some other things, but those will be key players depending upon affordability. If you're breast cancer and you're undergoing some therapy, I might, even though you're not using this class of chemotherapy agents, I still may do some coenzyme Q10 based on some work done by Dr. Carl Folkers going back to the 60s all the way through the 90s on the high doses of CoQ, how it oxygenates cancer cells, which is what you want to do because cancer cells want to live in an anaerobic environment without oxygen. When you drive oxygen into the cells, it disrupts its poisonous mechanisms. So you want to oxygenate tissue, CoQ, all right? So we've covered a little bit of D3 is an immune modulator, P5P, a form of B6 for the areas of chemotherapy agents that are damaging to the nervous system, the neurologic system, and so on. I didn't cover the lignans yet, so we're going to circle this. We're going to cover lignans. We're going to come back from the break, and we're going to go to a break in a minute. We're going to cover I3Cs, talk a little bit in that area. Avomar, some discussions here, and whatever else we can come up with. I mean, there's still some other thoughts that I would like to try to get across to you, but we're going to go to a break right now. Just as I'm going through this, I don't want this to be confusing. I want this to be supportive. I don't want this to be overwhelming. I want this to be directive in nature. Remember, we started with in cancer, antioxidants or supplements, part 1. Can you do it? What do the naysayers say? And then what does some of the literature say? We agreed to the fact that there needs to be more randomized controlled trials to solidify the position that I take and many other integrative healthcare workers that are working in this area to try to integrate. We know that the article that I quoted you from, that there's two big things. The controversy that comes up from chemotherapy use and how it damages other parts of the body, but yet no one wants to talk about it because it's what you have to do, right? And that's what the medical community will tell you, and I understand that. Number two, no one wants to talk about the breaking down of the body that occurs, that why so many folks can't withstand. So we want to prevent cachexia. We want to prevent collateral damage. That's what this is all about. So part 1 is reducing the amount of controversy, trying to shed some light about why you can do specific nutrients. Today is a little more specific, breaking them down. I'm not going to get off on too many kind of tangents with artemisinin, and there's a lot of other. Proteolytic enzymes are not all that controversial in my opinion, so we'll talk a little bit about proteolytic enzymes. But for right now, we're going to a break. Just a couple of minutes. We're coming back. We'll wrap this up. Stay tuned. Thanks for being back with us. We got a lot more to cover. Just a quick message. I discussed this earlier, as I typically do on the radio show before. John, Gospel of John. And you could be a believer listening to this, and I always say you could be an unbeliever. And just hear me out. If you're an unbeliever and you don't want to hear this, just humor me for a few moments and just listen up. Verse 30 of the Gospel of John, and Jesus says, there was the voice from heaven. It was God speaking, and those who were around him said it was like thunderous. They didn't know what it was. They were afraid. He said an angel spoke to him. It was just thunder. They didn't know what it was. Jesus said, the voice didn't come out for me, but for you. Come out of the sky. God speaking to him. At this moment, the world is in crisis. Now Satan, the ruler of this world, will be thrown out. And I, as I am lifted up from the earth, in other words, that he's put on a cross, in essence, will attract everyone to me, gather them around me. He put it in this way to show that he was going to be put to death. Voices from the crowd answers, we heard this. We heard this from God's law that the Messiah said, how can it be necessary that the Son of Man would be put to death? Jesus said that for a brief time that I will be with you. By the light you have darkness, you have destroyed. You will walk in darkness. You don't know where you're going. If you have the light, believe in the light, then the light will be within you, shining through your lives. You will be the children of light. Jesus, in essence, was saying, this must happen. I'm going to ascend eventually. But I do all this because then I need you to become an extension of me. That you need to become Christ-like. So if you happen to be a believer today, as I am, say, well, you know, you Christians are all phonies. I would hope not. And let me just read to you something out of one of Charles Spurgeon's writing. This was in Acts, and it says that they marveled. The people around the disciples marveled. And they realized that they had been with Jesus. Now this is powerful. How would these people know that he had been with Jesus? Why would this scripture be there? I believe because they were with Jesus. The disciples spent time with Jesus. They received from him. They literally had the power of God almost literally like transferred into their lives. But how into their lives? How do we get to that point? So I would hope that all Christians are not phonies. We're not perfect. Don't claim to be perfect. It's not what this is about. This is about surrendering and submitting your life to him because this is about eternity. Now this is beautiful. A Christian should be a striking likeness to Jesus himself. We should be like Christ. Christians, Christ-like, little Christ. When they once beheld us, they exclaimed, he has been with Jesus. He has been taught of him. He is like him. He has caught the very idea of the holy man of Nazareth, that he demonstrates it in his life and everyday actions. We should be living it out. If we're following him, that I should be living out. I should be an example of Christ in the flesh. Christians should be bold for Christ. They should be valiant for their God. They should imitate him with a loving spirit, a kind spirit. We should think kindly. We should speak kindly. We should do kindly. Then they'll say of you, he has been with Jesus. We should be zealous for the master. We should be going about doing good. We should be self-denying, not seeking my own interest all the time. I should be devout. I should be fervent in prayer and in deference to others, that I should prefer others in love. Then I'm about doing the Father's will, just as Jesus has said he was about doing the Father's will. And best of all, to be able to forgive. If we're able to forgive even our enemies, that's an example of being Christ-like. I didn't have the exact scripture that I wanted here in John, so am I going over here or am I still... All right, whatever, let's just go over here. Back to our topic. I hope that encourages you. It's a message that we always want to try to bring to really just uplift you, because these are heavy subjects many times that we cover. And many folks are battling significant health issues, very dire health issues. I want to put this into a format that you can understand and use. So let's quickly go over a couple of thoughts that I'm just going to read these to you, just the excerpts, the headlines, so you have an idea. Then we're going to get back here. Reduction of Adriamycin toxicity by ascorbate in mice and guinea pigs. What's ascorbate? Injectable forms of C. Adriamycin was that anthracycline type antibiotic chemotherapy that's used a lot of times for breast cancer, amongst other things. And what they were able to show is that there was a reduction in the toxicities by using vitamin C with guinea pigs, with laboratory animals. You reduce the amount of damage. There was no interference to the chemotherapy, but it reduced collateral damage. Number 2, melatonin. This was done by Paolo Lasoni in Italy, Milan, Italy, talking about how melatonin is an effective treatment. Watch this, treatment he uses. Cancer-related thrombocytopenia, which is breakdown of your white blood cells. You become leukopenic, those white blood cell components, and to prevent chemotherapy-induced platelet decline. So thrombocytopenia is a breakdown of your platelets. Leukopenia is your leukocytes. Neutropenia, neutrophils, documented black and white in human beings, in physical humans, not even in animals, that melatonin reduces chemotherapy damage to the immune system, to your platelets. Until now, melatonin therapy of cancer has been generally considered as an alternative treatment to chemotherapy. In contrast, this study should suggest that melatonin may contribute to the realization of chemotherapy in metastatic cancers in patients that are unable to tolerate the chemotherapeutic approach because of persistent thrombocytopenia, drops in platelet counts. Melatonin, we use extremely high doses, time release, 15, 20, sometimes 30, sometimes as high as 40 milligrams to assist folks. Another article coming out of Italy, Department of Internal Medicine, University of Florence, Institute of Pathology, talking about the role of maintaining your macrophages, your monocytes. How? With the use of melatonin. Integrative Journal of Cancer Therapies, 2005, June 4, shows that coenzyme Q10 can prevent the cardiotoxicities. This was done at UCLA, David Geffen School of Medicine, the Johnson Comprehensive Cancer Center, showing that CoQ can block the effects of doxorubicin, daunorubicin, anthracycline. Remember I said that the ones are very toxic to your heart. Melatonin, adriamycin combination, enhanced anti-tumor activity, reduced cardiotoxicity. Fancy words. Using melatonin, specific forms of chemotherapy, you literally actually enhance the anti-tumor effects of the chemotherapy and reduce the negative effects, in particular the ones that are damaging to the heart. Chemotherapy, intestinal permeability, 10 patients documented and show that they're on chemotherapy with a lactulose mannose test that folks develop leaky gut, damage to their gastrointestinal wall. It happens literally to everybody that's on chemotherapy. So why we talked about glutamine and why we talked about probiotics. There's other things. This is the basics. Chemo, neuroendocrine therapy of metastatic breast cancer, thrombocytopenia, melatonin, epirubicin, fancy terms, blah, blah, blah. What this is saying is simply this. Metastases with breast cancer. Get patients on high doses of melatonin. It's a phase 2 trial study in Milan, Italy, Lissoni again, that literally you can actually enhance the response, use lower doses of chemotherapy. You say, but you're not an oncologist. That's not my role. That's for the oncologist. This is where the world of oncology is not exploring and not looking at. What did we start with? Many patients are not able to sustain therapy because of breakdown of the body, cachexia. Many cannot because their immune systems are destroyed. There's so much collateral damage to other parts of the body. And our role in discussion here, not to supplant your chemotherapy. That's not what this discussion is about. I'm not here to tell you to stop doing it. I'm here to say that if you're doing this, this was to bring light to a controversial arena of how antioxidants can actually be useful, supplements can be useful, targeted nutrients helpful in patients that are undergoing radiation and chemotherapy. Carnitine, I talked about L-carnitine, reduces the fatigue, improves quality of life in patients undergoing chemotherapy, increased functionality, body mass maintained, less damage in the body, appetite improved, less cachexia, and on and on and on using L-carnitine. Vitamin E can help reduce paclitaxel-induced peripheral neuropathy. That's one of those platinum compounds. Or, excuse me, that's not a platinum. Paclitaxel is another of the Taxol group, Taxotere. There's a lot of neuropathy that's associated with these pharmaceuticals. Damage to your nerve endings. Vitamin E, the right forms, can reduce the damaging effects and be protective. Glutamine. American Journal, or excuse me, this was an Asian journal in clinical nutrition, 2012, looking at glutamine for chemotherapy-induced diarrhea. So we didn't even talk about that. Diarrhea is a huge issue. So besides the glossitis, the alimentary canal. Well, the alimentary canal is from your mouth all the way to the anus. So literally, not only does glutamine help you orally in the mucosa and the intestinal tract, but it's even documented to reduce the amount of diarrhea that's associated with chemotherapy. Clinical efficacy of glutamine in the control of chemotherapy-induced diarrhea remains controversial. They're saying, boy, we don't know what's going on. We don't know what's out there. But if you look at the literature and you look at the trials, you could reduce the severity of gastrointestinal complications. Glutamine, a novel approach to chemotherapy-induced toxicities. Glutamine supplementation was found to protect against radiation-induced mucositis, damage to the mouth, anthracycline, another chemotherapy, induced cardiotoxicity, and paclitaxel-related myalgias, arthralgia. Glutamine may prevent neurotoxicities of paclitaxel and the platinum compounds, amongst others. The lists go on. Folks, this is only a portion of what we pulled, all right? Giving you an overview. Let's quickly bounce over to, I wanted to talk about, and then we're going to close on this segment, lignans. The importance of flaxseed. Flaxseed, I think patients that are prostate cancer patients, breast cancer patients, you should be on these compounds. Literature shows that lignans can be protective. Phytoestrogens are plant compounds which in the human body attach to receptors, female sexual estrogen receptor sites. They actually reduce the amount of enterolactones. The result was significantly only for the group, not for the group, only that was on these lignans, flax-based compounds. Should be doing a scoop or two a day or a tablespoon or two a day if you're a breast cancer patient or a prostate cancer patient. So we talked about E. We've talked about the lignans that are in flaxseed. It's a messy board. I didn't want to wipe it out because I wanted to leave everything up here because when I look at these, you know, it's almost a way of reminder. And again, excuse me, I'm going to talk a little bit about Avamar. But boy, there's maitake, shiitake, mushroom extracts. There's beta-glucans that we should discuss. There's so much, so I think I am going to take a little bit of this off because there's so much still to discuss. So let's just talk about Avamar real quick.
I got a couple good shots of the board. So.
You got a couple good shots. So we're up there. That was rolling. All right, let's just talk about Avamar shortly. Avamar. What is Avamar? Avamar is a fermented wheat germ extract. All right, Avamar. What makes it special? Avamar, Hungarian researcher, showed that Avamar, this fermented extract, actually can reduce cancer cells' ability to use glucose in cancer cells. So before you run off and say, oh, Joe has, you know, he's talking about a natural prep that treats cancer. No, I'm not saying that. What I'm saying is that one of the things that we know about cancer cells, they're obligate cancer or sugar consumers, glucose consumers. Avamar, this fermented wheat germ extract, can reduce how quickly cancer cells utilize and uptake glucose, which is hugely important. Number two, the literature also shows that Avamar can reduce chemo-induced side effects, which we've kind of been, the whole role, everything we've been talking about is using nutrients to reduce some of the damage that occurs. So Avamar is a very interesting compound with some amazing attributes in this area. So I think you can utilize it as support. You can utilize it while you're on chemotherapy, radiation therapy, to help the body withstand the rigors, once again. But it also actually, if you will, has natural anti-cancer type activities based on its principle, its pharmacology. The other areas, I3C. I3C is of the brassica cauliflower, broccoli concentrates. It increases how the liver detoxifies. It has isothiocyanates in it, which are literally have anti-cancer mechanisms. They're plant-based foods that have anti-cancer mechanisms. So I3C, I think, should be the part of a lot of, quote, what would be termed, I don't like this term, hormone-related types of cancers, prostate, breast, and so on, have to be on some type of formula. We like a prep that combines the I3C to use as support, along with diindolylmethane plus calcium D-glucarate. So we have one that combines all of these, so it helps evil, bad things be excreted through the liver that are related to hormone types of cancers. So just kind of dovetailing. Artemisinin, I think, is an interesting compound, probably not the place for it right now. Beta-glucans. Beta-glucans, and I think we'll wrap up because we're way over again. Mushrooms, clean, shiitake, maitake mushrooms, isolated to have high sepin, cordycepin type concept so that it's a highly isolated formula. We need to be addressing the immune systems of cancer patients. What's happening? What's happening? Well, certainly we get to go. I'm not even going to talk. This is not a place for the genetics and the gene. There's so many chemicals that we're exposed. There's so much assault that take place to our body. And all we're trying to do here is to get the body into a mode where it can begin to function better based on your ability to give it some nutrients. But you got to be off sugar. You've got to be doing the ABCs first. You've got to be eating a plant food diet. You should be thinking about some juicing, predominantly vegetables. You should be thinking about, in my opinion, you do what you want, IV vitamin C. I really believe that is a key player. Then you've got to be doing the support mechanisms. Beta-glucans are immunosupportive. They don't kill cancer. They support your immune system. Quality shiitake and maitake mushroom extracts have high cordycepin content that increases their activity, their immunostimulating properties. And lastly, for this discussion, can't go any farther, as much as I would like to, proteolytic enzymes. I did mention it on the first one. There have been a lot of individuals over the course of years going back to probably 1920s and 30s, and actually even back in the earlier 1900s, using high doses of pancreatic enzymes. And a particular oncologist, Nicholas Gonzalez, that's in part one, and I know I mentioned him, an integrative oncologist in New York City, uses an organic diet, all whole foods, live foods, detoxification mechanisms. I believe they do other integrative approaches. I'm not that familiar with the clinic, but he does also IV vitamin C's, I believe. But one of the other parts of the therapy is to use very high doses of proteolytic enzymes to break down the outer shell of tumors or the protein layers. So one of the big issues, if oncologists or if researchers would be honest with you, what they would tell you is one of the things that we have no way of dealing with are these proteinaceous layers. So as cancer cells begin to form tumors, what they do is literally almost secrete a type of a membrane that is outside, if you will, or is a covering to bad cells that literally shields itself against your immune cells, so that your immune cells actually go right past and don't even recognize bad cells or tumor cells because of this protein lipid layer or protein bilayer that literally is secreted that almost camouflages, acts as a camouflage. And then that's where some of the work with Nicholas Gonzalez is all about using. He will do 30, 40, 50 tablets a day of these proteolytic enzymes for severe, almost untreatable types of cancer with chemotherapy and so on. Using this concept, along with whole foods, live foods, organic foods, no chemicals, detoxification, but utilizes this concept. So, again, before you just start doing things out on your own, we've covered a lot of ground. You can see it's very complex, and we kept it as generic as possible This is all about support. How do we support individuals through the bigger picture, an overview, so that we can make sure that you understand the ABCs. Always ramping up the immune system, your own immune activity, always trying to protect your immune system, and ultimately working at a level that utilizes nutrient supplementation to help the body withstand the rigors and the difficulties of chemotherapy treatment. Folks, make sure you go back and view part one. Part one, I believe, was very good because it laid down some interesting parameters for us to kind of work with, or where we were able to start. The first discussions that we had dealt with supplementation, the core, the antagonism that is out there in the world of oncology. And we're here basically to make sure that you understand there's discrepancies. What does the literature say? And then how do you integrate, how do you understand the ABCs and how you integrate an approach? I tell you, unless a kernel of wheat falls to the ground and it dies, in other words, it has to go into the ground, it remains only a single seed. But if it dies, literally to this life, if we die to this life, that's what Jesus was using an analogy here, it produces many seeds, or it sprouts. See, if we begin to learn to die to this life, to this self, less about me, less concern about myself, more on others, giving, sacrificial, servanthood, serving Him, serving others, Jesus says what happens when that happens, you begin to literally sprout. Anyone who loves their life will lose it, while anyone who hates this life in this world, or Jesus was saying anyone that doesn't desire it more than he desires eternity, will keep it for eternal life. Whoever serves me must follow me. Where I am, my servant also will be. Where, in other words, he should be leading, we should be following. I mentioned to you earlier out of some writings from Charles Spurgeon about us literally exemplifying him. My Father will honor the one who serves me. In the here and now and in the temporal, that's a hard concept to understand because we're sense beings. We sense and we feel and we touch. We want to know that the now. We have to understand that there's an eternity. It's the unseen world. And the more you begin to read this good book, the more and more that eternity becomes a part of your life and a reality to you. God bless you. Thanks for being with us. Tell some of your friends, neighbors, whatever, to watch the video. I think it'll be helpful. Until next time, another topic, another subject. God bless you. Go with God. Have a great day.